Hello, everybody. This is Nursing Reviews. Today, we are going to briefly talk about peripheral arterial disease, abbreviated as PAD. This is a common arterial disorder that typically affects the lower extremities. So, this is going to impact the blood flow to the legs. This disease is caused by atherosclerosis, which is the same pathophysiology as coronary artery disease. So if you remember learning about stable angina, chronic coronary artery disease, think about that disease process, but we are just moving it to the legs. So this is going to cause those narrowing or blockages of the arteries supplying the distal extremities. So basically think of blood supply to your foot being occluded by those fatty plaques kind of building up on the arteries there. And that, of course, results in reduced blood flow, reduced perfusion, which means less oxygen delivery, which obviously can cause symptoms and damage over time. So risk factors, smoking is a big one. Same with coronary artery disease. Smoking accelerates that process rapidly. Also things like diabetes, high blood pressure, high lipids, and of course age. It is also linked with systemic cardiovascular disease and increases the chances of having a heart attack and stroke, simply because if you're building plaque in your leg arteries, you are probably also building plaque in your heart arteries and in your brain as well. So that is why it increases the risk of that. The most common presentation is what is called intermittent claudication. That is a fancy term that is often used on exams, but basically what that means is when the patient is walking or exercising or exerting themselves, they get the leg pain and cramping, and when they rest, it gets better. The reason is that you are increasing the oxygen demands while exercising, walking, and if you have diseased arteries, you cannot deliver that blood, so you are going to have a decrease in the supply of oxygen and therefore have cramps and symptoms. As the disease develops, you can get pain at rest, you can get non-healing ulcers, skin changes. You typically have cool, pale skin with a lack of hair, like shiny kind of shins is a symptom. Again, that's a result of decreased blood supply. And you can have gangrene, which is tissue cell death in extreme cases. The most common way to diagnose this is called an ankle brachial index. You basically take the blood pressure of the ankle on the distal leg and compare it to the blood pressure of the brachial or artery, which is on your arm. So you take those systolic blood pressures, put them in a fraction, and that's your index. You can also do things like ultrasound, Doppler imaging, feeling for those pulses, the dorsal pulses on the feet. All those can kind of aid in the diagnosis. Number one management is lifestyle changes, obviously stopping smoking, exercising, eating healthier to reduce those fats and the plaque. We also have antiplatelets because we don't want a blood clot to form, statins to reduce the cholesterol in the blood, again, try and reduce that plaque formation. You can also have treatments that are more surgical in nature, typically with vascular surgery, angioplasty, stents, things of that nature. Very acute presentation is called a critical limb ischemia, which is basically a very quick and rapid cessation in the blood flow to that leg, typically. And that obviously is going to cause cell death, the gangrene, sometimes amputation has to be done. So that's going to be a very painful condition that people come in with. And it's definitely an acute complication to look out for. And again, this is all very closely tied to systemic cardiovascular disease. So if you have a patient with a history of strokes and heart attacks and they have that leg pain, that should always be in the back of your mind. And of course, we will be looking for the ABI or the ankle brachial index as kind of that hallmark of diagnosis.